Our next speaker for today is Dr. Divya Shetty, who's a consultant in Glaucoma Services, Shankar Nethralaya, Chennai. She did her MS from RIO, Chennai, and a clinical fellowship from Shankar Nethralaya. She has various papers and poster presentations to her credit and has won the Best Poster Award in GSI 2017. Over to Dr. Divya.
And non-visual glaucomatous fields. All visual field defects in glaucoma patients are not always glaucomatous in origin. Visual field testing is inherently prone to artifacts and errors. It depends on the subjective response to a stimulus in an artificial environment. Visual field defects could be due to any abnormality anywhere in the visual field. It is important to recognize artifacts and non-glaucomatous visual fields, whether the defects are due to glaucoma progression or not, because it influences the management, escalates medical therapy, helps in additional of laser therapy or recommend surgery. Artifacts and non-glaucomatous visual fields could be patient-related, eye-related, visual pathway-related, that is, non-glaucoma-related defects could be because of retinal disorders, optic nerve or disc abnormality, or central nervous system-related disorders. So patient-related artifacts could be due to the poor understanding of the test procedure, patient fatigue, or general health-related issues like Parkinsonism, dementia. So this is a common example of an artifact. White scotoma seen in a trigger-happy patient, where the patient responds even when the stimulus is not presented to him. So this is characterized by high false positive errors, normal total deviation with an abnormal pattern deviation, and the glaucoma hemifield test showing an abnormally high sensitivity. Clover leaf pattern is another common artifact seen due to patient fatigue. Here, the patient who is initially attentive responds well to the central testing points, and as the test progresses, because of fatigue, he would not respond for the peripheral points. So another entity called reverse clover leaf, also known as 4-dot artifact. Here, the patient misses the first 4 cardinal points, later picks up. Lens rim artifact is an artifact due to the incorrect positioning of the trial frame lens when the patient is positioned far away from the trial lens. This is an example of a lens rim artifact in a normal healthy disc where after repeating the test with the adjustment of the lens, the defects are not there. So you can see artifacts due to repeated contact procedures on the cornea, like applanation tonometer and gonioscopy just before the field test, suggested by depressed points in the paracentral area in the first field, which after repeating on another day is not seen. So in the COVID times, we have seen mask-related artifacts also, where we will see defects in the inferior field due to the mask, and after repeating the fields with the adjustment of the mask, the defects are not seen. Learning curve is another common field artifact that we see. It's a disc photograph of a 48-year-old male open-angle glaucoma patient showing inferior notch and inferior rim thinning in the right eye with corresponding nerve fiber layer defects, and similar picture in the left eye also. This was the first field done in 2023 showing defects in the superior arcuate area. The same person, after 6 months, repeat fields showing reduction in the number of the defects, though there are some superior defects in the right fields. So other eye-related artifacts are due to small pupil, media opacity, uncorrected refractive error, and ptosis. So this is a visual field test of a primary angle closure disease patient on pilocarpine. The first field is done with a pupil miotic. So as we can see, there are defects in the peripheries, but after dilatation, the visual field test is normal. Artifacts due to media opacities. This is commonly seen due to cataract or uncorrected refractive errors also. So the first visual field is showing generalized reduction in sensitivity due to cataract. Post-cataract surgery, the repeat fields are normal. So artifacts due to high refractive errors. This is seen in patients where high power trial lenses are used for correction. It's a case of a visual field of a patient with high hyperopia where the correction is plus 7.25, showing defects in the peripheries. But after the contact lens, the defects are not seen in the next field. So unrelated abnormalities causing visual field defect, this could be due to retinal disorders, myopic disc, central nervous system related. So this is a field test showing a constricted visual field in a patient with a retinal dystrophy. This is a superior arcuate defect, but on fundus examination, there is a retinochoroidal coloboma inferiorly, which is causing the visual field defect. This defect is not due to glaucoma. It's a myopic disc showing enlarged blind spot in the visual field test. This is a tilted disc causing superinasal defects in the visual field. Other optic disc disorders which can be congenital or acquired also can cause visual field defects which can mimic glaucoma. This is an example of a 26-year-old male who was started on glaucoma medication based on a suspicious disc. On examination, the right eye disc shows an optic disc pit inferiorly without any maculopathy. And the visual field test is showing enlargement of blind spot and central defects. This is another example of an optic disc disorder, optic nerve hypoplasia, which is superior segmental. An 18-year-old presented to us in 2013 with glaucoma medication started elsewhere with no record of high IOP. On examination, the right eye disc shows a superior notching with a nerve fiber layer defect, but on careful examination, there's a subtle pallor of the superior rim with a scleral halo. Visual field test in 2013 showed defects in the inferior periphery. Even after 10 years, the defects are stable. The patient had been stopped on medications, though there is no progression of the defects. So even the GOCT showed superior nerve fiber layer thinning, which was stable. So this is a rare entity which has to be kept in mind. So any young patient presenting with pallor of the superior optic disc with peripapillary scleral halo and a central retinal artery which has relatively superior entrance to the eye, this entity has to be kept in mind. So another optic disc disorder which presents with visual field defects is an optic nerve head drusen. Here in this example, there's an enlarged blind spot because of optic nerve drusen. Other optic nerve disorders which are acquired can cause visual field defects similar to glaucoma. This is a disc photograph of a 78-year-old male coming with a sudden drop in the vision in the left eye. As you can see from the disc picture, there is a pallor of the disc with some blurring of the margin superiorly, and the visual field test is showing an inferior altitudinal defect. Another example of optic nerve disorder commonly seen is toxic optic neuropathy. Here the patient had a history of treatment with tuberculosis for 6 months, and disc both eyes showing temporal pallor, and visual fields showing central defects in both eyes. This is an example of a 57-year-old female presenting with defective field of vision only in one eye with an RAPD on clinical examination. Visual field defects showing constricted fields. So MRI showed a left orbital apical meningioma causing compressive optic neuropathy. So this is a visual field test of a 21-year-old with a history of trauma showing inferior defects secondary to traumatic optic neuropathy. So other causes that can cause similar field defects like glaucoma, and this is an pie in the sky appearance in a patient with tuberculoma. So this is a 16-year-old female with both eye discs showing pallor and symmetrical defects in the inferior hemifield in both eyes. MRI brain showed periventricular leukomalacia, so the defects suggestive of hypoxic ischemic encephalopathy. So this is a case of a 75-year-old glaucoma patient presenting with visual field defects. 2015 fields were normal. 2017 when he came, he had a left homonymous hemianopia. The discs were stable in both eyes. On neuroimaging showed a infarct corresponding to the defects. Again in 2022 there was worsening of the defects in the inferior hemifield, though the disc was stable. So repeat neuroimaging showed another infarct in the left anterior cerebellum. So any new defect appearing in a glaucoma patient without changes in the disc, always rule out other causes. So glaucoma can coexist with other conditions also. This is a 75-year-old male with right eye inferior rim thinning and subtle pallor in both eyes. So this was the fields showing superior attitudinal defect in the right eye and left eye parietal and inferior defects. So MRI brain was normal. So this was a primary open angle glaucoma with ischemic optic neuropathy component and a left eye chronic CSR also. So glaucomatous visual field tests always respect the horizontal meridian. They are typical and expected pattern. Insert into the blind spot and structure function correlation will be there. So take home message is it is important to recognize artifacts in visual fields, repeat fields when in doubt to avoid over treatment. Glaucoma can coexist with other conditions also. If there is any unexplained visual field loss not corresponding with the disc, needs detailed evaluation to find the cause. Thank you.